You should all sit really close together. Kia ora, ngā mihi nui ki koutou katoa. I'll hand over to Dr. Caroline McElnay in a moment for an update on the latest case numbers before sharing a few comments with you and then taking your questions. Dr. McElnay.
Thank you, Deputy Prime Minister, and kia ora koutou katoa. 1 o'clock media statement provides a summary of today's cases, so I'll just give a brief overview. There are 92 new COVID-19 cases in the community reported today. Of these, 80 are in Auckland, 2 are in Waikato, 1 in Northland, 5 in the Bay of Plenty, 1 in Lakes DHB, 1 in Nelson Marlborough, and 2 are in Taranaki. We are also advising of 3 additional cases in Taranaki who are known contacts with an established link, bringing the total number of active cases in the region to 5. The cases are self-isolating across 3 separate households in New Plymouth, Rotorua and Waikato. On the advice of the local health unit, public health unit, Devon Intermediate School in New Plymouth has closed today after it was linked to one of the cases. Close contacts associated with the school have been identified and is underway. Case interviews are ongoing and any further locations of interest will be published as usual on the Ministry of Health website. With regards to hospitalizations, there's been a decrease from yesterday and we have 79 people in hospital with COVID-19, including 4 people who are still being assessed. 9 of these patients are in ICU or high dependency units. On vaccine, very pleasingly, we can advise that Matamata and Canterbury have now become the 3rd and 4th District Health Board areas after Auckland and Capital and Coast to reach 90% fully vaccinated. Also, the average across Metro Auckland DHBs has now reached 90% fully vaccinated. That's fantastic progress. Tamaki Makaurau has borne the brunt of the Delta outbreak and its people have been the vanguard of Aotearoa's vaccination efforts. Really want to thank all of our health providers and all Aucklanders across the region. They can all share the credit for reaching those fantastic milestones. On My Vaccine Pass, the Ministry has now issued more than 3.25 million My Vaccine Passes. Again, that's a mammoth effort in just over a fortnight, and I'd like to thank all of those involved, including, of course, those who have downloaded theirs. It means nearly 90% of all vaccinated New Zealanders now have their passes. Additionally, more than 370,000 international vaccination certificates have been issued so far, with those numbers continuing to climb. While many of us are looking forward to greater freedoms under the COVID-19 protection framework, we must remain vigilant. Today, we are reporting unexpected detections from wastewater samples taken in Matamata on the 29th of November and Gisborne on the 1st of December. Follow-up samples are underway. Our advice remains, if you have symptoms, no matter how mild, please get tested, even if you are vaccinated, and remain isolated until you return a negative test result. And finally, I'd just like to remind people to please keep scanning in or manually recording where you've been. Yesterday, there were nearly 3 million scans across the country. This will be more important than ever as we are now in the COVID-19 protection framework. To put it simply, our everyday essentials are mask, pass, and scan. It is these things that will enable us to enjoy summer whilst we continue to live with COVID on our own terms. Back to you, Deputy Prime Minister.
Thank you very much, Dr. McElnay. As all of you are well aware, New Zealand has now switched into the COVID protection framework, or as it is becoming well known, the traffic light system. We were able to make this move because we have come through the past almost 2 years of COVID in better shape than many other places in the world. We've had amongst the lowest case rates, hospitalizations and death rates in the OECD. As we head into this next phase, critically we do so with high and rising vaccination levels. Of the eligible population, we now have 93% with a first dose and 87% with full vaccination. Of the remaining 5 DHBs still to reach 90% first dose, the Lakes DHB has just 785 more vaccinations to go, and the West Coast DHB 284 to reach the target, with a big push that could be done in both of those DHBs by very early next week. I do want to pause here and thank all New Zealanders for their actions to keep them, their families and their communities safe. Some people have tried to portray us as a divided nation on vaccination. The numbers simply do not bear that out. Getting 90% plus New Zealanders to agree on anything is a highly unusual achievement. We have come together once again to do this mahi, and we should be very proud of the progress that we have made. It is, of course, early days for the framework and the vaccine pass system that is intrinsic to it, and we can expect that there will be a few teething problems over the next few days. It is hard to remember back to the beginning of the alert level system, but the same thing occurred then too. We will be constantly monitoring the settings and making tweaks as necessary, as we did the whole time we were in the alert level system. And again, here I want to thank businesses for their cooperation in getting the vaccine pass system going. And I want to make a request to those of you who are out and about this weekend to please be kind and respectful to staff who are checking passes. They're doing their job, and we are all learning as we go. Just a couple of numbers here to reiterate what Dr. McElnay has said. As at this morning, we have issued 3.25 million My Vaccine passes, including 250,000 just yesterday. As indicated by the Ministry of Health last night, 54,500 individuals were issued an exemption email because their service request had not been resolved. I can tell you that 99% of those emails got through and 94% of them were opened. There will be a second run of those emails tonight to cover those for where there were issues with the emails, and that will cover all those with an outstanding service request. I want to remind businesses that the 8th round of the wage subsidy is still open for applications, even though we are now in the new framework, and applications for this round will close at 11:59 p.m. on December the 9th. The resurgence support payments numbers 4 to 6 remain open for applications through until the 13th of January next year. And also the transition payment, which I announced on Monday, opens for applications from the 10th of December, next Friday. This payment is a recognition of the long period of time businesses in Auckland in particular have spent with restrictions in place prior to shifting to the framework. The payment is designed to support those businesses through the next few weeks, and we encourage you to apply via Inland Revenue from the 10th. This transition payment is at a higher base rate than the current RSP, which will be $4,000 per business, plus $400 per FTE, up to the cap of 50 FTEs, a maximum payment of $24,000. And as I said on Monday, that is estimated to have a total cost between $350 and $490 million. The affected revenue period for the transition payment will be set between October 3rd and November 9th, and will be compared to a typical week in the 6 weeks prior to the 17th of August. Finally, before we go to questions, I have the pleasure of letting you know that this will be the last Friday 1 p.m. press conference for the year. Obviously, there will be others through next week, but not next Friday. I want to acknowledge that 2021 has provided significant challenges for many people, but also further evidence of the resilience, compassion and resourcefulness of New Zealanders. And that applies to all of you in this room. I want to thank you for your hard work in disseminating complex information under huge time pressure to ensure that New Zealanders remain well informed through this pandemic. While we might not always agree on what comes out the other end, this has been an enormous and exhausting task that is vitally important. And with that, I'm happy to take your questions.
There's been huge confusion with physiotherapists, and they've only in the last hour got a note saying that they can't ask people for vaccine passes. We've had a lot of lead-in to this traffic light system. Why are there still those glitches that are happening, and are you satisfied with that?
As I said in my opening remarks, if we cast our minds back to the beginning of the alert level framework and you look at the tapes of your questions from that time, you'll find that there were glitches and wrinkles that needed to be ironed out as we went through each phase of the alert level framework. It is complex to set a set of rules that guide the way in which all businesses and all venues operate. And so therefore we will see some wrinkles there. I'm sure that the physiotherapists as close contact businesses and ones that are involved in that healthcare system, they've always, and you'll recall we've had some conversations about them at higher alert levels as well, they do sit in a space that may have caused some confusion. I'm pleased to hear that it's been resolved.
And councils, what's your expectation with them with vaccine passes? Because I know the Upper Hutt City Council have said no, they don't require vaccine passes, and they are now reconsidering that. But what expectations do you have for councils?
So councils run public facilities, and we have given them the ability to be able to decide how they will work. Not unlike private companies who will also be deciding how they work. Some councils have taken the decision to require passes, others have not. Obviously, in the end, it is the facilities that they run. I know particularly in the area of libraries, for example, there's been concerns that they are almost like an essential service in some places for some people, and councils have taken decisions with that in mind. What I would simply ask is that they're clear in their communication and that people understand how that works. But in the end, they are their own authorities and they have the ability, as a private business does, to make their own decisions.
There's another case in Nelson today. So what's the advice you're getting around how bad that outbreak there could get?
I'll hand over to Dr. McElnay, but this morning on the call that we had, we did not get any advice that it was moving beyond what we would expect. Obviously, we've seen excellent testing numbers, I think around 1,400 tests over the last day or so, which is encouraging to then not have too many extra cases today. But like everyone in New Zealand, we're asking the people of Nelson to be vigilant. I think it is an important note that Dr. McElnay made at the start. While we've done very well and it's encouraging to see the overall case numbers coming down, we still have to be vigilant. COVID is still a serious virus for many people, and we do need people to take basic public health precautions, but particularly to be tested if they have symptoms. Dr. McElnay?
No, thank you. They've got 14 active cases in the Nelson Marlborough District Health Board area. The Public Health Unit is working very hard with local businesses that have been affected, and I think there's a school in particular, as I mentioned, that's been affected. The Public Health Unit there is really sort of managing all of those cases and their contacts, and it's hard to say whether we would get more cases. We certainly see in these situations that where we see the highest level of risk is within households. So if there's been a case in a household, we usually do expect to see some further cases. But at this stage, we've no particular cause for alarm in Nelson Marlborough. Testing rates, as the Deputy Prime Minister said, have been up, which is really good because that's what we want to see. We do want to pick up cases.
And so should the community there be concerned or be preparing for a move to red, or what is the threshold there?
That isn't on the cards at this point. As Dr. McElnay says, the outbreak is not causing us alarm, but as I would just repeat what I said, we do need people to be vigilant, to wear their masks, to make sure that they keep the appropriate levels of physical distancing depending on the circumstances they're in. But especially to be tested. I mean, not specifically on this outbreak, but more generally, we are seeing people present quite late in terms of their symptoms. And so we do still need people to be thinking, if I've got any of those symptoms that we've traditionally associated with COVID-19, be it a cough or a runny nose or a sore throat, do get tested, because that way we can get onto it early.
Minister, you talked about a divided nation. Should the vaccinated people have anything to fear from the unvaccinated?
Well, we've set a system up, Barry, to make sure that we are supporting everyone in New Zealand to stay safe. And the whole point of vaccination passes is that in high-risk environments, we're asking for them. The point I was making is that when we have over 90% of New Zealanders with their first dose, I'm simply not going to accept that we are a divided nation. There are people who hold different views about vaccination. People are entitled to hold those different views, but I think as a country, we've come together amazingly over the last few months to see those vaccination rates rise. We have set up a framework that is designed to keep New Zealanders safe, and I believe that we'll do that.
Perhaps Dr. McElnay would like to comment on the health risk for others with unvaccinated people?
Well, just to back up what the Deputy Prime Minister says, we've got very high rates of vaccination, and so vaccination is always a mixture of individual protection that the vaccine gives you as an individual, but also the protection as a community. I think what we're seeing is with those very high rates that we can be assured going forward that our risk for COVID, as we've seen, is declining, and we're seeing that with the case numbers, particularly in Auckland, those very encouraging fall in numbers. And I think it's about the combination of those high vaccination rates plus the protections that we've put in place through the framework.
Mr Robertson, can you clarify also, for once and for all, what is the situation with Māori manning roadblocks in Northland?
So the roadblocks in Northland are police checkpoints, and as good policing would dictate, they've worked closely with the community, and in this case with iwi, around the design of those, and they will be working with them as those checkpoints occur. But it's really important to note that they are police checkpoints, and the police are the people who are in charge of those checkpoints, working closely with iwi. I actually want to congratulate both the police in Northland and local iwi for working together on this, to coming up with a solution that's appropriate for that community. Northland still has one of the lowest vaccination rates in the country, and there is still a need to be cautious. And so, the police know how to do this. They've worked closely with the community before, and I'm sure it'll be fine.
Do Māori under the Health Act have the right to pull over cars?
Under the Health Act, there's a Section 22 order that allows iwi to work with the police, to be able to do that work. But these are police checkpoints, and obviously whatever legal requirements will be met, the police of all people will make sure that happens. But Barry, I don't think this is anything for anyone to be worried about. This is actually really good community policing.
Chris Luxon says that Auckland should be at green. Why isn't it?
Well, it's not at green, firstly because we set some pretty clear guidelines around where we would put people, and we still have a significant outbreak of COVID-19 in Auckland. And whilst the numbers of cases coming down is very encouraging, it is still a significant outbreak. And throughout the whole period of COVID-19, we have moved cautiously and methodically. And actually, the result of that is that we have managed to keep the number of deaths low, the number of hospitalizations relatively low, and I stand by that approach. I've certainly heard from the opposition many different ideas about moving more quickly at different times. From our perspective, we think the proof of the pudding is there.
You say that the traffic light system or shifting to it is complex at first. Is it needlessly so? Why couldn't you have just stuck with the alert level system and laid vaccine certificates across it?
I wouldn't say it is complex, actually. I think that it is a relatively simple system.
If the public understands it.
Well, no, that's because it's just started, and I think if you started right back at the beginning of the alert level system, you might well have come up with similar numbers around people's understanding of it. It is a very simple system, especially if you are vaccinated, because if you are, what you need to make sure is that you have your pass with you and you have your mask with you, and you can go about your business, particularly in the orange level, without any real concerns, and at the red level with 1 or 2 restrictions on gatherings. So I think it actually is a relatively simple system, but of course, it's new, and therefore people will take some time to get used to it.
I'll just go back to what Barry's question was too. Can people expect to be pulled over by iwi as they're travelling around?
What they can expect is a police checkpoint working with iwi.
No?
What they can expect is a police checkpoint. That's what's been agreed. That's the agreement that is in place. Joe?
Just going back to the Northland vaccination rates, which are obviously stubbornly low still, is there any shift, I guess, over summer in terms of reaching more people, like changing up the way that the vaccination rollout has gone to date? Because you've kind of reached a point where those who are going to be have been. You're going to see a lot of people going to beaches, to parks, holidaying. Is there sort of any approach around mobile vaccination clinics going out to these sorts of places? Are you changing it up in these regions where the rates are still stubbornly low?
The first thing I'd say is we already have changed it up, and I think over the course of particularly the last month to 6 weeks, the idea that we can set up static places and expect people to come, we've moved progressively away from that. So there are already a number of mobile vaccination clinics and processes in Northland, and yes, I do expect that over the summer period that will continue. The vaccination campaign doesn't stop anywhere. Once we get to 90%, it keeps going, and most especially in an area where we're under 90%. Is there anything more on
No, I
that?
was just going to say that actually we have seen an increase in the Northland vaccination rates. So these recent, different ways of doing things have certainly worked. And the latest figure today for Northland as a DHB as a whole, first dose, is 86%. So really that's getting close to the 90%, and that's fantastic work.
Can I also just ask on a slightly different topic, just with the new variant kicking around, which obviously isn't in New Zealand yet, but is there potential at all for those dates that have been set for next year around Australia and other countries and people coming back in 7-day self-isolation, is there any risk that those dates are going to move at all over the Christmas period?
No, not at this stage. We would obviously go on the advice of Dr. McElnay and her team around that. There is nothing at this point to point to that. The whole question of what happens with a new variant is that the WHO and others do a lot of work to understand the severity of it, the spread of it. That work is underway right now. And while we can be concerned about it, as has been said here a couple of times, we don't at this point have any advice that is a cause for anything beyond concern or moving into major shifts in our approach. But of course, if we got different advice, we would look at that advice. So I'm just going to hand to Dr. McElnay.
I was just going to say that we are keeping a very close eye on what is happening and what we know about Omicron, and we're obviously we'll be giving further advice beginning of next week. This is a period when scientists across the world are particularly looking at the severity of the disease, because it does appear to be more transmissible, but it's really about the severity of the disease, and then in particular whether or not you can get either reinfection once you've had a past infection, or whether there's any suggestion that the vaccine may not be as effective. And we don't yet have that information, and that's what we really need in order to be able to advise a different way of doing things.
And bear in mind, just the other point I'd make on that is obviously what we do have is Delta, and what we do know is that Delta is highly transmissible, and therefore the systems we put in place, the precautions we have, the way we've moved cautiously is actually already directed towards a highly transmissible and quite severe variant. So we actually do have those systems in place, and while we don't know yet the full details of Omicron, we have made the decisions we've made when we have Delta present, which is a highly transmissible.
So lastly on that, your advice would be, because there will be people who are choosing not to try the ballot, the MIQ system, because they're relying on these dates in January and February. Your advice to people is to continue assuming that is actually going to stay in place.
Correct. Yep.
Thank you. Just on the community isolation, can I get an update on how it's going, how many people are isolating at home, and where in New Zealand they are?
So in terms of numbers, what I've got in front of me here is that we've got 936 cases as reported as being in self-isolation at the moment across the country. The numbers reflect where the cases are, and so there are a handful in some of the DHBs where we've got a smaller number of cases and obviously a large number in Auckland. I haven't seen any updated report around any particular concerns. Obviously, we continue to work with both the public health assessments and the medical assessments. And obviously, again, this is a new system that's bedding in. Primary healthcare providers are more involved. I've seen 1 or 2 news reports this week, people still wanting to make sure they get information quickly. And obviously, the teams in Auckland will be working on that. Did you have anything?
No, that's right. I think operational things like this do take time to bed in, but we're seeing very good progress in Auckland, and still bedding in the Waikato. And then obviously what we want district health boards is to be able to go no matter when they might get a case. And we're seeing that as we do have this scattering of cases across the country, that DHBs are standing up and that those systems are coming into play.
Just on the the recent report on the first 2 deaths that sort of raised that the system could sort of magnify inequity for Māori and Pacifica. Has the system been changed at all since then, or?
There's certainly been significant, yes, I mean,
Yes,
yes, it's the
yes.
short answer to the question, because that obviously those cases were obviously right at the beginning, and there's significant work gone on to partner with Māori and Pacific providers to make sure that the right people are having the right conversations at the right time with cases, and obviously, you know, as we've stated earlier in the week around that report, there's a lot to learn from that. And I believe those lessons are being learned, yes. I'll just do a sweep around and go, Bernard, Amelia.
Minister, what sort of thresholds does Auckland need to reach to be able to change from red to orange? Because there's a few hospitality businesses who are hoping that sooner rather than later.
And certainly we want them to move sooner rather than later as well. Those movements will be based on the advice that we get from the Ministry of Health and the Public Health team. Obviously, there's about 4 or 5 different things that we're looking at for any region. The first of those is vaccination rates, and Auckland is doing extremely well there and continues to make really, really good progress. We also look at the status of the outbreak, and that is the significant issue for the Auckland region, is the status of the outbreak. How big is it? How widespread is it? We're seeing, again, good signs there, but we obviously want to get updated advice as we move towards the 13th of December check-in that we've got. And then there are the issues around the health system, the ability for it to cope, again, holding up well, but we need to keep monitoring that. The contact tracing systems and making sure that they work well, and then an analysis around the impact on vulnerable populations. So we'll look across all of those criteria. As I say, Auckland's doing well, but we will continue to move cautiously when we've had such a significant outbreak there.
So we're down below 100 cases today, and you're still below 100 hospitalisations, and the DHBs bordering Auckland are getting up towards there. I mean, how close are we?
Yeah, look, these are very encouraging signs, but I'm not going to preempt the advice that we'll get from Dr. McElnay leading in to the 13th of December, but I've outlined for you the things that we're looking for. Did you have anything to add there?
No, and I wouldn't want to preempt the assessment that we'll be doing next week, because as we've seen, this is a constantly evolving situation, and we always give our assessment as close in time as we can through to ministers so that they can make that decision.
Is it still possible, though, there could be a move down for Auckland from red to orange?
Yeah, look, it is possible, but I don't want to preempt the decision. I don't want people to run a story that now says that is likely. It is possible, and the reason we put the check-in in was so that we could look at it not just for Auckland, but actually for all regions. And, you know, as I say, there's some really encouraging signs, but we'll take this day by day. I've certainly learned in the whole last 2 years to be careful about predicting what happens over a week, let alone 2 weeks. Amelia.
Just back on passes, there's been reports of hospitality places not requiring vaccine passports. How will you be checking that businesses needing vaccine passes are actually complying with the rules?
Yeah, and so the thing we're doing there is operating as we have again throughout COVID of you know, first trying to understand the circumstances. There's an educative element, I think, here, you know, to help people understand what is required of them. And then obviously, you know, as time wears on, if there are people who are, you know, deliberately and flagrantly not going along with the rules and the guidelines, then there will be follow-up action. But I think the first steps here are to help everybody understand what their obligations are. And I haven't, to be honest, haven't heard widespread examples of that. I'm sure there'll be 1 or 2 out there. Sometimes people perhaps need to take a look at the specific rules. There are different rules for retail than there are for hospitality, for example. And so people need to be able to understand the circumstances, and we can follow those cases up if they're raised with us.
When you say, is that sort of police going around and double checking that the businesses who should be using the passes are using them?
As I say, if things are drawn to our attention, there's a number of different ways of dealing with that. And obviously at the end of that escalation, there is, you know, enforcement. But at the beginning, we just want to make sure we get alongside people and make sure everyone understands what their obligations are.
And just a few points of clarification of this so-called simple system. The farmers markets are confused about whether they need vaccine passes because they do both retail, selling groceries and veggies, but they also have food trucks.
Yeah.